All right, why don't we come back together? So one thing that came up that some people actually haven't seen what the SLO looks like. So we can pull it up on one of our computers so people can actually come and take a look at it to actually visualize. It's one of the things that when I meet with students, I actually pull out the SLO and show them what it looks like. It's like one of the first advising meetings, so they know what goes into our letter for them. You know, the different ranking systems, how we compare them to last year's students that went into EM, how we say what they may show up on our rank list, just so that they're aware of what the letter looks like. The other thing would be is everybody does their SLOs a little differently. So what I tell students is, any away rotation that they're doing in EM, they should ask for a SLO, even if it is for like an ultrasound or one of the other ones that they still need to ask for a SLO. The way we do our SLOs is we do it by committee. I think some people do it more by individuals. We do it by committee. So we have our program director involved in it, myself, we have the assistant clerkship directors. We basically will sit down, we go through all the comments they've gotten from on the rotation. We look at potential research that they've done. We look at what their previous scores are, because all those things do obviously feed into how that student's going to rank. I know other people will actually may get their chair on it. I've had some people will actually have a student ask for an individual letter and then a departmental letter from the same rotation. We generally don't do that because a lot of times it's the same information. I mean, asking someone, like I worked with a student once to write a letter compared to, you've got 4 people who are looking across the whole thing. I don't think much gets added. Now the caveat for that is there are some programs who have said they won't offer interviews unless they have 2 SLOs. So if it's a student who's doing a later second rotation, then I may say, it's not the worst idea to get that second SLO, just if people are just looking for those 2 SLOs before offering interviews. Do you guys do it? Anybody else do a different process for it?
Well, we actually do that where we can get 2 SLOs from our rotation because we also have a group of educators, the SLO group, which our department does similar to other departments. It's the program director, the vice chair of education, the clerkship director, and the director of our boot camp course. And they get, most students, every student that rotates on our clerkship that's going into emergency medicine gets a department SLO. That you don't have to ask for it, you're getting it. But because some rotations or some interview programs like 2 SLOs, there's a group of us that aren't on the department SLO that can write a letter for students. So I wind up actually writing a lot of letters because I'm not on the department SLO right now. So I think it helps our students. And then as they do their away rotation, they can send up to 4 letters. So if they choose not to send the one I wrote, that's fine. And for the other thing I'll just say about aways is what you said is true, although sometimes if you do an away rotation on ultrasound or EMS, sometimes those programs won't write students a SLO. So I always advise my students, if you're going to do an away rotation on ultrasound or EMS or toxicology, and you're counting on that rotation for a SLO, make sure they'll write you one, because sometimes you're not getting shifts in the ED and they won't write a SLO. So it's just important, for you guys when you're rotating that you inquire, hey, is this a rotation I can get a SLO from?
I'd say, and having reviewed applications, those SLOs are viewed differently, at least we do. If it's an ultrasound SLO, especially if they haven't done a whole lot of other clinical shifts, we do look at that differently. We may not put as much kind of weight into that compared to like one of the clinical SLOs. So why don't we have have each of the 4 people kind of come up, give a little synopsis of the patient, or not the patient, no, the student, and then what the discussion was. You want to start, Will, since you're closest?
Sure. Am I doing it or someone else?
Oh, you want to hand? You can hand it off if you want.
All right. So our patient scenario was our student scenario, thank you, was a student who had kind of low step scores, but then clinically showed a trajectory of improvement, honored our rotation, got a high pass in a second EM rotation, had a lot of appealing features with involvement at state level, worked in legislation, had a letter of recommendation from a big city mayor, so a lot of extracurricular involvement that was very promising. But this particular student did not mesh well with some people within our department, and so there were some very strong voices that did not want the student to match at our department. So the question is, how do you generate a narrative that highlights their strength while also accounting for the fact that you may not end up wanting to rank this student. And so we had a good discussion about, at first, how to generate a narrative that highlights some of the strengths. So this narrative of leadership, that it would be good to be forthcoming about concerns about knowledge deficits from step one, but that they have this improving trajectory clinically and sort of how to frame that appropriately. And then I think a lot of our discussion centered around how do we approach this topic of we may put in the bubble, we're not going to rank them, or we're going to rank them lower third or mid third, and yet our comments are going to try and highlight them positively. Do we need to address that discrepancy, and how do we do that if we want to? And so a lot of the comments here that we discussed are that these slows, for those of you who have read them, there seems to be a lot of reading in between the lines. And so these discrepancies come up, and when they do, sometimes that suggests something that maybe there's a red flag that isn't necessarily highlighted in the narrative. And so do we have a duty to address that in the letter, or can we say, oh, there's a discrepancy, there's a red flag, and move on? Or do we pick up the phone and call them and say, hey, why is there this discrepancy? And I don't know that we actually came to a solution or a joint sort of thought on that, other than to sort of discuss that in the current state of slows, it seems like there is a pattern of maybe needing to read between the lines a little bit as program directors in the position to read these when those discrepancies come up. And we don't have a solution to offer yet, but that's where we got.
Well, I think it brings up the topic too, because again, these other issues may be outside of the clinical experience. So are you required to bring them up versus not?
And I probably don't do this enough, but I would encourage communication if there's an issue with a letter. I was telling our kind of subgroup here, I had a student do an away rotation and get a do not rank letter from that rotation, which is kind of, as you know, is the kiss of death. And the narrative didn't really fit do not rank. It was students' presentations were at level of training kind of thing. And so I actually called that rotation and had a conversation with the clerkship director about, hey, I'm just making sure this isn't a mistake. And I've also received phone calls about letters. So I had a student apply to a program, and since this time, we review every letter before it goes out, because it was written by like one of our faculty that doesn't write a lot of letters, and it just frankly wasn't a very good letter. And so we don't not send a letter, but we also use this as an opportunity. If someone's writing their first letter, they probably need some mentorship on how to do that. So I'm not saying you have to do that, but it helps when we receive feedback about a letter as well.
And so again, for those that haven't seen the slows before, there's a part on there that kind of asks about like how many letters you've written in the past. So what one of our sites does is, the student will ask for like basically an individual if they work with clinically for that letter, but the site director at that location will review all the letters. He makes sure that kind of the rankings are consistent across all the students, and then he actually co-signs it. Because again, he's able to see all those. So again, he's written a lot of letters before, so he kind of able to adjust it and kind of frame it a little bit better.
All right, so our scenario, we had a third EM away rotator who did pretty good on their exam, 85% with a mean of 83. Had a high pass when about 2/3 of the students were getting honors, who had some good clinical comments, saying that there's a good fund of knowledge, some negative or not as positive, saying that was dismissive of patients, needed to have, despite good fund of knowledge, needed to have a better differential. And then there was some things from didactic sessions saying some assessors were noting that the student appeared disinterested, and then during simulation needed to lead the team but also try to think aloud so that other people could work through things. And so our discussion kind of focused on how do you highlight, because clearly this student had some positive qualities. They're committed to EM. There is a little bit of a discrepancy that he didn't get he or she, I don't know if it's he or she, didn't get an honors despite some of the strong fund of knowledge. So we thought, maybe in the narrative, focusing on strong interest and proactive in EM, clearly is, pursuing with a third rotation, showing good clinical fund of knowledge, but has areas of growth that include, expanding differential diagnosis and maybe communication skills that could be remediated in additional training through residency. And then kind of coming back at the end and saying, despite these areas or these drawbacks, that they don't have any significant red flags and will be able to perform, going forward, so that you don't completely sink them, because it seems like they're probably a decent candidate still, even though they do have some drawbacks.
Yeah, so it's kind of with the third rotation. Like, there's one student we were discussing a little earlier with the other medical students. I've had students do a third rotation actually not even let me know about it. Because usually we have to sign off on it. So if they're not looking to get a grade on their transcript, they actually can do it. And we had a student who on a third rotation had, it was one of those where it's like 3 lines of a slow, so not a whole lot of information, but one of the lines said he was painfully shy. This is an otherwise student who had done fine. So again, those are some of the risks of doing it. And that third one, and maybe it was just off for whatever reason, and it came across a little stronger. So again, how much do you rely on some of that information?
So our student scenario had a relatively low step 1 score, a pretty good step 2 score, high pass in their first rotation, and in a second rotation got honors, and then had a kind of crisis of identity and took a year off to decide whether or not they wanted to continue in medicine in general, and worked sort of on a ski patrol, and then came back and did a third EM rotation and got honors in that. So in the comment section, they were generally very positive, things like eager to help out, good attitude, good presentations, which we would want to highlight. The areas for need of development, there was a theme that the student may not communicate or present in an EM style, and given that they performed well on their rotations, we would have included that in their slow, something to the effect of, it was observed that their presentations, were not communicated typically like an emergency, physician would, but with the appropriate guidance, this could be trained out of them type thing. The last thing that we discussed was whether or not as the letter writer to include an explanation of the year off, and I think we didn't really come to a consensus because it would depend on the context of the writing. So if we were as the away rotator, we would not comment on it at all. If we were very familiar with the student and were a mentor for them, we may, but at the end of the day, this probably comes down to the student's responsibility in their application to address it. And I think that's what we have.
So any comments from you guys? Like, would you address if the student had, again, that took a year off, didn't really do anything medically for that year, and it really was more of that crisis, do I want to do medicine or not? Would you guys include a description of that, or would you leave it up to the student?
I think life experience is important for what we do, and so I would probably expound upon that. Like, the student went out and gained some valuable life experience that's going to help them relate to patients.
And if you can include a specific instance of, this applicant apply this knowledge gain in patient interactions or something like that to show that it was.
So for our scenario, our student was step 1, step 2, 220s. They failed CS and they retook it and passed. They were essentially a straight pass medical student. They had done a pass in EM as their home institution, honors as the away rotation, had a couple EM publications, and had some active volunteering. Kind of looking at their comments, kind of some themes we saw. There were some discrepancies, but were generally described as enthusiastic with reasonable presentations, but otherwise not necessarily the strongest comments for the applicant. we kind of discussed addressing the issue of whether or not to discuss the Step 2 CS failure, and we kind of were somewhat vague and said they had some challenges with their academic success, but that we felt solid in their candidacy. We addressed the fact that they had commitment to the field in terms of their EM publications. We kind of, touched on the fact that they were generally described as enthusiastic and motivated, but would probably need a program that would continue to develop them. So it's kind of where we were. I think the real issue with us was, this is somewhat of a subpar applicant with a failed CS, and addressing that on a slow.
So for those that have kind of looked at SLOs and read through SLOs, what are the other kind of issues that maybe you've seen reading through them that maybe didn't come up? Any other topics people want to bring up? So I think with the SLOs, I mean, there is, that reading between the lines can be a plus minus. I think for a lot of us, if we do know the program or the individual, reach out or have some connections. But it's really hard especially for early SLO writers, like that between the lines, what does that really mean? You need kind of almost like that track record of letters to know like what between the lines actually means. So I think it can be plus and minus for the individual student. And I think definitely if there's discrepancy, like I said, if they got honors in your rotation, but you're putting them in the lower third, I think you do need to describe that, to be consistent in that. So as the receiving program, you may just completely dismiss it. They're a lower third, I'm just not going to look at them. But again, are they a lower third because they're just not right for your location? Are they a lower third because, again, these outside issues or other issues? So I think just being clear on those. All right.